Some of these questions do relate to specific presentations, but do welcome all members of the panel to comment and give their thoughts on each of the answers as they wish. So I'll start with the first question. If a disc displacement is not dealt with, can the moving of the jaw to the side become worse? Or is this a condition that an individual can live with and does not progress?
So I may answer that question. So when if your disc is displaced with reduction, so you just have a click and you have a normal range of motion, moving the jaw anywhere, it will not really necessarily aggravate or improve the condition. And there are many patients that it can be just with a click or a sound for many, many years and never progressed. And some people will, at some point in time, be locking that jaw. So it's case by case and depending on the situation. But now, some people now know, some patients knows that the jaw will lock if they will go to a specific spot. So if you know that, and then don't move the jaw there, you don't have to, because you know it will lock. So why? But no, maybe something to conclude is that if you have just a click and nothing else, it's not an ideal situation. But at the same time, if you have a normal range of motion and you have no pain, but you have a click only, I don't see and I would not really recommend any active treatment. I may just recommend some tips to, again, prevent that progression. I give you some tips to not get a problem, but I will not actually advise you to proceed with any active treatment.
Thank you, Dr. Hernandez. Next question, if surgery is required, what is the cost and is this covered by healthcare?
That may be a question better answered by an oral surgeon. That is non-conservative treatment. And in some cases, absolutely the only way to fix that is with surgical intervention. My understanding is that some of those part of that treatment is actually covered by Alberta Health Services, and part of that is not. But I think that would be a better answer by a surgeon, and not every surgeon likes to do surgeries on the TMJ. So there's only a couple, at least in Edmonton. I'm not sure in Calgary, maybe another couple that will like and they have the training and feel confident on doing those procedures.
Next question, how do you find someone to prescribe, suggest, or make the right mouth guard, for instance, for grinding, pain, and sleep apnea? Is there a type of mouth guard that would provide coverage for all of these issues?
So as I mentioned, and then I think the three of us mentioned somehow, there are dentists that with additional formal university training for that, and then the specialty again in Canada is oral medicine, and it's not an official specialty, but also we have Dr. Abdurrahim and myself, we are oral-facial pain board certified. We would be a specialist in United States, but here in Canada is not. There are a few practitioners in Calgary and here, beside us, that they have that special training. In regards to a device that can manage apnea and TMJ, it may be possible. It will have to be case by case. Regarding coverage, it depends on your dental and medical coverage. And sometimes the medical coverage may cover some. However, we will not have access to that. So patient will have to pay in full and be reimbursed by the medical coverage.
Yeah. Next question, if you have bite issues, is this related at all to TMD?
That is a very controversial question. There are research. So the research says nowadays that the influence of occlusion in TMJ is marginal. very, very, very minimal or non-existent. There is no consensus that fixing your bite, it will improve your TMJ issues or your pain. And I think that I mentioned that, there's no correlation again into abnormality of anatomy and severity of pain. So I have people with a horrible bite and no pain, people with a perfect bite and severe amount of pain. Again, there's no real correlation between bite abnormalities and severity of pain or TMJ issues. Not always. Now, don't get me wrong. Sometimes people have a very bad bite and they have TMJ issues, and sometimes I'm able to stabilize them enough so they can have a functional bite, because at least they will have one issue, right? That it will be the TMJ issue and be able to chew and talk better. We're talking about when people have contacts only in one tooth and every other tooth is not really aligned and is not really contacting. Very, very few cases. Again, it's a multidisciplinary team where I have to work very closely with the orthodontist, sometimes the general dentist, the family dentist, in order to coordinate. Sometimes people have, immune disease. We have to talk to the rheumatologist to make sure that we're not making things worse. So again, it's not only one practitioner, it's a multidisciplinary care to try to get, whatever the patient needs and wants.
Next question, can someone address treatment options for facial pain secondary to TMD? For instance, all the little facial muscles working to hold the mouth closed.
I'm sorry, can you repeat that? I think that you were maybe not too loud. I don't know.
Yeah, for sure. Can someone address treatment options for facial pain secondary to TMD? For instance, all the little facial muscles working to hold the mouth closed.
I'm not sure if I understand the question. I think in the video, Diane Royland, the physiotherapist and member of the board of directors, she did provide some exercises for managing TMJ issues. And sometimes, those exercises will decrease the muscles of the face. Or that facial pain that people complain. Now, remember, sometimes that facial pain is not really coming from the muscles of the expression of the face. It's just referred pain that feels in the face. Dr. Abdulrahman, I'm not sure if you can pitch in, or you have, I misunderstood, or you can add something to that.
No, I don't think I can add just trying to go back to the question. Yeah, definitely the question is not that clear. We have to identify the problem. Facial pain could be coming from different sources. Recommendation will be depending on the specific source of the pain in here. So it's going to be kind of hard to be very specific on that answer.
Move on to the next question here, and then I'll jump off, but I'll let Dr. Hernandez continue with the rest of the questions that have been posted in the chat. So next one, what are some ways healthcare providers can provide better post-operative or post-intubation care for patients having a TMJ-TMD flare-up or locked jaw to prevent headaches or pain during recovery, as most times jaw must be open wider for a longer period of time?
So I think that one thing that I always tell my patients when they go through, right, it depends, is that they mention this to the anesthesiologist, to their medical team, saying, you know what, I have TMJ issues, and just for you, when you intubate or whatever you have to do, just be aware, right? So I think that communication is key. Now, sometimes patients, again, I think that somehow forget, they have been stable for a while, or the jaw was not really an issue. They were, stable, so they get them off guard that they go into the surgery and they have this issue afterwards. But if you're having this issue ongoing, then communication is key. And then I always tell my patients, at least, if whatever you have to do, that is very important, right? Because it's very important, we will deal with the locking or flare up or exacerbation of your jaw issues afterwards. But if you already have a good physiotherapy person that can help you with that, if you already know a few jaw exercises, a few tips, as Karen was mentioning, having some heating pads, some ice packs, some menus of softer diet, right? Things around that, some medications for short period of time use, as Dr. Friesen was mentioning. It's important to have all that in place, so in case that this happen, you already know what to do. That would be my suggestion. So there's one question, Dr. Abdurrahim, that came in the chat, and I think that you will be better off to answer. So would you be able to address any connection between osteoporosis and oral health or issues?
Yeah, that will be very interesting. Thank you for the question. Yeah, definitely, like osteoporosis, it's a disease that will affect the density of the bone. So it's affecting the bone in general, but the jawbone will be affected as well. So we will definitely see a higher risk for bone loss that will affect the support for the teeth. The teeth will be suffering from probably mobility. People will have problems down the road. So definitely prevention is going to be very important. If you are having taking medication like bisphosphonate, it's going to be putting you in a risk for let's say dental extractions. So first of all, communicating with your dentist, letting them know, and prevention is going to be a very important and not having the problem. So as we said, instead of dealing with the problem, regular dental care and preventing the inflammation, preventing the periodontitis will give you a better chance to save those teeth. If you're on medication, if you're on taking the bisphosphonate, this will be something that need to be taken in consideration. We have to take the precautions. Specific technique has been taken during the extraction, and follow-ups will be definitely highly recommended.
Thank you so much. And one more question for you, Dr. If you can, it was not in the topic of today, but if we just can give maybe a couple of tips or advice for people who are suffering from burning mouth syndrome.
Okay, so this is a very interesting topic. Burning mouth syndrome, it's a very it's not fun to have. It's not easily to be diagnosed. If you're having this issue, definitely you'll be seeing several doctors trying to find solutions. So the first thing, you will have the pain, but it's going to be so hard to see any symptoms in the mouth. So the diagnosis will be the first thing that we will have to do. Sometimes, in my clinic, when I will have the patient, we will do some blood work to make sure, they have no underlying health conditions. They are not having any deficiency of certain vitamins and stuff. Sometimes we will make sure to rule out any oral infections like candida and other things. And if everything will come back clear, one of the best medication that I will start with is a medication that will be used. It's a tablet that will be prescribed, and if it is working nicely, we will definitely come back as a conclusion that it's a burning mouth syndrome and it can be given for that patient, and it has been scientifically proven to be effective in addressing the symptoms of burning mouth syndrome.
Thank you so much. So I will just answer one more question for the sake of time. I appreciate that everyone is staying with us until this end. And we have a question about myofunctional therapies, where it fits in our treatment modalities. So I think that myofunctional therapy basically are a specific therapy to address function of the muscles. And they play a role, I think, when people are not, the muscles are not working that well in function, not necessarily for pain, right? And I see a real role in sleep apnea, and it has been documented that it could be is an approved adjunctive therapy for managing snoring and sleep apnea. They have shown that it could be quite successful. In the case of TMJ issues, there's not a consensus that is effective, research proven to be indicated. I'm not opposed, okay? And in some cases, people who are coming, that I see people after car accidents, they begin to bite their cheeks or their lips, and then I think that myofunctional therapy, then it will play a very important role. But I don't really see prescribing that because someone is having pain in the muscle, right? I think that I will go out with other therapies first. Now, if the patient would wish to go to that therapy, by all means, I will not oppose. So I think that with this, I will give a closure to the panel discussion. I want to again thank everyone for attending this event today. I really appreciate your attendance, your support to the society and to these events. Again, if we don't have an audience, there's no point to prepare this event. So thank you so much for coming. Thank you so much for staying until the end with us. I would really like to thank again, and I haven't mentioned, but Ardela is a member committee, and she has been working very hard in the background, very quietly and secretly, collecting all your questions and giving them to us so we can answer these at the end in this panel discussion. I also would like to give thanks to Girasol, who is the managing company for the society and keep us all online and our toes to be on time for the meetings, and that make this event also smooth. I would really appreciate that you take the time to fill out those evaluation forms and obviously comment about the performance of this event today, and also any ideas for future topics, because we want to make these events about topics that are interest for you, so you can be empowered, you can learn, and then you can be better managing your pain. So with that, again, thank you so much to Jeff Allen Productions, to Figo Studios, to Girasol, to all the committee members, especially Ardela, who you did not see but was in the background, to the speakers, to Dr. Friesen, who could not stay teaching duties, Dr. Abdurrahim, thank you so much for your time and expertise. Karen, thank you so much for coming and sharing your journey. And thank you again to each one of you for being with us this afternoon. Thank you. Have a good day and have a wonderful Canada Day on Monday and long weekend. Bye-bye, everyone.